I've had people come in, no disrespect to anyone, with lips that they look like they've had at least 7 ml of lip filler in their lips, and they're coming to me for more filler, and it's like, no. I would say the biggest misconception is,
if a trans woman comes to you to see you, can she expect results straight away?
it's changed people's lives, literally. Sometimes I've done noses that look better than surgery cases.
Wow.
Yeah. We obviously, the newest thing that everyone's going wild for is the salmon sperm.
I've heard about
Salmon
it.
DNA is
Salmon
what we
DNA.
say, not to be offensive. I obviously have become quite good friends with some of my trans clients, and I know their journeys, and whether you're trans or not, there's just some horrible people out there, and I've seen the effect that it does to people emotionally. I might get a little bit teary because I've seen the effects that it does.
If someone has unrealistic expectations, talk to them. If someone has no idea what they want, but they know they want something enhance their own natural beauty, again, communication. Can people do the consultation online as well, like on video, if they, let's say, they live a few hours away from London?
I feel like I want people to be comfortable in their own skin, and if you can help that and it's not harming anyone, then just leave people alone, and that's why I do it. It's not about just having people tell me what to do. No, I kind of have to tell you what you need to do, because that's where that stigma of people like, oh, you're fillered up and things like that, is because people are just saying yes to clients because for money. Whereas, obviously everyone needs to make a living, but I also have people's mental health on my hands. Obviously the trans community does come with a lot of emotion, so it's like I become like, I don't want to say an agony aunt, because I don't want to be that old. More like a sister.
Right? This is better.
Sister. It's a sisterhood, literally. So you get swelling for the first 2 weeks. People automatically get used to that swelling, and where the swelling goes down, they think the filler's gone, but it's not. So it's like they're continuously trying to chase that initial dopamine hit. A bit like chasing the dragon, is what they say. You might have an amazing result, someone will see how amazing it is, and they want that same result, but they have a completely different phase. So it's a completely different method and technique. I mean, you can see at the moment, there's like women, they all look the same. The lips, the chin, the jawline, they're all going for the same look. You don't need to strive for the same look just because it looks good on someone else.
It's so
you have your own look. You are also beautiful. Like if people are rushing you and getting everything done like 5 ml in one session, all right, different areas, but if it's like just all the cheeks, no, red flag. Right, if you look after your skin, you won't have to do so much filler, or like feminization or not, like your skin makes you feel, good skin makes you feel feminine.
What's the percentage of like risk, or are there any major risks when it comes to non-surgical treatments? Hello everyone, and welcome back to Trans Crush, the podcast where we dive into the lives, stories and experiences of trans women. I'm your host Pevi, and today's episode is a little different because we are joined by Chrystianna, who is an aesthetic medicine professional with over 17 years of experience in the industry. She is passionate about helping her clients feel confident, affirmed and seen, including the trans community. From non-surgical to surgical treatments, Chrystianna is all about creating a safe and inclusive space where everyone can feel at home in their body. And I'm so happy she's here with us in the studio. Hi Chrystianna, welcome to Trans Crush.
Hi Pevi, thanks for having me.
Thank you so much for taking the time off the day to come here to the studio and be with us and talk about the experience in your industry, in your work, and also your trans clients, because we're on Trans Crush, so we can talk about that. So the first question is, what made you start doing aesthetic medicine in the first place?
Oh, okay. So, I mean, I've been doing it for it's nearly 17 years now. I'll keep losing count. But I started beauty when I was 16 years old. And what made me really delve into the aesthetics industry was I was in a car accident when I was 19 and I sustained quite a lot of lacerations and had a bit of reconstruction on my face. And I think after that, where I was so involved with the aesthetic side of things and I saw how it helped me, like scarring and things like that, I just wanted to do that. And that's why I've only just focused on the aesthetics and advanced aesthetics. So pretty much it's a traumatic experience, but it's a positive that's come out of it because it started my future up.
Yeah, 100%. Would you do any other profession if it wasn't this profession?
Oh, God. Well, I don't know.
You don't have time to think about it.
Yeah, I haven't thought about it. Yeah. No.
But so you said you've been in it for 17 years now. You've been doing. I know you've been doing Botox. I know you've been doing fillers.
Yeah.
What else do you do?
So Botox and fillers isn't the number one thing that we actually do. I think people think that's our main focus, but we do things like advanced aesthetics when it comes to the skin rejuvenation, anti-aging, non-surgical facelifts. I have a team of surgeons who do cosmetic surgery, plastic surgery. We really focus also on facial feminization and masculinization and surgical versions as well. Versions, is that the right word or term? But yeah, so we've got a whole menu of things that we do. So it's more about I like to focus on things where it's transforming people's lives. So yeah, how long's a piece of string basically on what we do.
So where are you based?
So we've got a few locations. We are based on Harley Street, Marylebone, Seymour Place and Brentwood. And also Surrey, plus Enfield, but Enfield is more of just like a very small, basic, like non-surgical little tweaks here and there.
Yeah. So you work with trans clients.
Yeah.
Why is it important for you on personal and professional level?
I think personal, it's more about, I just feel like everyone should feel comfortable in their own skin. It's not anything specifically directly personal to me. It's more of the emotion side of it. And I obviously have become quite good friends with some of my trans clients and I know their journeys. And whether you're trans or not, there's just some horrible people out there. And I've seen the effect that it does to people emotionally. I might get a little bit teary because I've seen the effects that it does. But I think like just leave people alone, and I feel like I want people to be comfortable in their own skin, and if you can help that and it's not harming anyone, then just leave people alone, and that's why I do it. On the professional side of things is because I know how to do it well. So why not? So if anyone's going to be good at doing something like this, it's me.
I just want to say that I've been a client of yours for the last 5 years now, and I can really say that I always felt so safe and welcomed, and I know I could trust you as well, that I can just sit down and you wouldn't do anything that you think I don't need, which is really important too.
I've said no to you so many times about things.
She did.
I know. Go, leave, get out of my pub. Literally, like Peggy Mitchell.
Yeah, I think it's really important to tell people like this is what you need. Let's be realistic about your expectations, right?
Yeah, exactly. I mean, listen, that's the professional side of things. I'm here to mentor people as well.
Yeah.
It's not about just having people tell me what to do. No, I kind of have to tell you what you need to do, because that's where that stigma of people like, oh, you're fillered up and things like that. It's because people are just saying yes to clients because for money. Whereas, obviously everyone needs to make a living, but I also have people's mental health on my hands. Yeah. So, and that's another thing that I have to be very aware of. Obviously, the trans community does come with a lot of emotion. So it's like I become like, I don't want to say an agony aunt because I don't want to be that old. More like a sister.
Right? This is better.
Sister. It's a sisterhood, literally.
Yeah.
So yeah, that's.
Yeah. Have you ever like turned anyone down in terms of like unrealistic expectations? You're like, you don't need it. I'm not gonna. Yeah. Again, it's your image. It's your business, right?
Yeah.
Like you don't want to mess up anyone's face.
Well, exactly. I think with HCLs, our image is literally natural results, right? So it's all about just enhancing and softening. It's not about changing someone's face completely. You don't need to do that. But I've had people come in, no disrespect to anyone, with lips that they look like they've had at least 7 ml of lip filler in their lips, and they're coming to me for more filler, and it's like, no,
I'm not gonna do it.
I will dissolve it for you and then start again. But fresh. I'm not. There's no point, because it's called fillerexia. So it's basically so it's actually a diagnosis. So,
wow.
Well, correct me if I'm wrong.
Yeah.
So basically what happens is, I mean, you know, with filler, so you get swelling for the first 2 weeks. People automatically get used to that swelling, and where the swelling goes down, they think the filler's gone, but it's not. So it's like they're continuously trying to chase that initial dopamine hit. A bit like chasing the dragon is what they say. And that's where a professional, if you're a good professional and practitioner, you'll turn people away.
Yeah.
You'll never just keep saying it. I'm not a yes girl anyway.
Yeah, it's important. We've heard some horror stories about, especially fillers, not as much with Botox, but definitely with fillers, when you can see really unnatural results. If someone wants to look unnatural, great, good for them. But I think majority people want to look the best version of themselves and enhance their natural beauty and look the best version of themselves. What do you think is the biggest misconception about aesthetic medicine?
I would say the biggest misconception is that people think the answer for anti-aging, facial feminization or masculinization, or anything to do with enhancing things is just filler, where it's not. And it's all about, they think, oh, you should just put filler in your cheeks or your chin or your nose. But they don't realize that's not always the answer. You possibly could get away with not doing cheek filler or chin filler and doing something with your jawline or something to minimize how much filler you put into the face. I mean, yeah, that's my opinion anyway. Filler's not always the answer.
I also realize people sometimes, they don't really have a skin routine. They don't take care of the skin, and they think that their problem will be solved, as you said, with a few mils of fillers or a little bit of Botox. But I always feel like it doesn't matter how much Botox you have. If you don't hydrate your skin, don't moisturize your skin,
Amen.
There's no results for
There's
you.
There's no point. Yeah. I think, I personally say...
Comes hand in hand.
Exactly. Your skin is your front of house. If your skin looks like crap, sorry, for the Urban Dictionary version.
No, it's true.
But if your skin is not on its best behavior, for example, because you're not looking after yourself, you haven't got a good skin routine, your lifestyle's really bad, no amount of filler or Botox you do is ever going to make you look fresh. Your skin is your face. Look after your skin. By the way, HCL is bringing out a skincare brand with CBD inside, so keep an eye out. But yeah, your skin, I always say, is your should be your best friend. Treat it like you're looking after a kitten.
And I always say, like, every day counts. Like, every single day that you take care of your skin.
Yeah.
Whether you, like, remove your makeup, cleanse, moisturize, like, everything counts.
We're all guilty of missing a day here and there, you know. Like, it's like you never want to, like, penalize people completely. Yeah. We're all human. But you have to, the three main important things is washing your makeup twice in the evenings, hydrate. I prefer hydrating serums rather than creams because serums, a good serum anyway, it penetrates deeper into the skin.
Right.
That's what gives you the glow.
And it's high concentrated as well.
Yeah.
Than moisturizers, right?
On damp skin hydration.
On damp
skin. So wash your face and pat it, have it a bit damp, and then put your hydrating serum and it will absorb in.
Write in the notes right now.
Yeah. Skincare tips.
Yeah, I feel like it's because, you know, people can't expect miracles after 1 or 2 treatments if they don't take care of their own skin on a daily basis, right?
I mean, listen.
Can you see some nice results?
You'll definitely see results. You'll definitely see something. But if, for example, there's no point. I would personally say invest in your skin. It's a no-brainer. Like, because if, for example, if you start in your early 30s and you haven't looked after your skin, I mean, like, for example, like microneedling or a good skincare routine, Morpheus 8 for rejuvenation, it's a preventative. By the time you get into your 40s, you're going to be just following filler. That filler is still there, but your skin is still aging over that filler, and then that's when it just doesn't look in sync.
Right.
Yeah.
That's such a good point. What is your take on people who doing DIY fillers or black market fillers in terms of safety? What's your opinion on that? If they can't afford it, they obviously, money is an important factor when you do aesthetic medicine, and people want to save some money, and then they do it black market or DIY.
Yeah.
What's your take on that?
I mean, obviously, I don't agree with it. Like, do your research, right? But at the end of the day, I have to be very honest. I know I don't know them personally, but I know some companies who have been in the industry maybe only a few years, and they're charging really cheap prices and actually doing quite good jobs. Whereas I know doctors and nurses who have been doctors and nurses their whole life and aren't doing very good jobs and not doing very nice things. Like, you know, I don't want to say too much. But yeah, so I think definitely do your research. If you were ever to go to anyone where it's a lot cheaper, make sure there's the reviews, like company's house, like how long they've been established for and things like that. But in terms of the negative side of it, I think the regulations in the industry are not good. But that's why it's one of those things. It's like you're never going to be able to avoid it. It's never going to. I personally don't think it's ever going to stop. It brings in too much money into the UK.
Right.
Yeah.
That's interesting. What should someone really consider before booking an appointment with either you or someone who they don't know?
Like for their first time, do you mean?
For the first time.
Yeah. I would say look at the premises, make sure they're registered, a legit company. Make sure I would say their booking system is very important as well. So if you're getting booked in and you're getting medical forms sent to you every single time, and how your consultation is, they're always good factors to look into.
Yeah.
And also look at people's results. Like if you go on some
100%.
Yeah, like
they speak for themselves,
yeah,
right?
What's the thing? You are who your friends are, kind of thing.
Right.
So you are who your results are.
That's so true.
I just made that up. That's like what a good analogy.
It makes sense.
Yeah.
It makes sense. Yeah. 100%. I feel like if I didn't know you and I would go somewhere else for the first time, I would definitely, I think I would go there because someone else recommended.
Yeah.
I think that's
and
good.
That as well.
If they're happy, they're like, yeah, I was happy, I felt safe. Especially if you're transgender and you go somewhere for the first time, you are scared, you are anxious, you want to make sure you're in a safe environment where you feel welcomed. You know, especially in the beginning of the transition, I feel, where people respect you and treat you like a human being, which I think it should be automatic or, you know.
Yeah, of course.
But unfortunately, it doesn't happen always.
Yeah.
So let's talk a little bit about your trans clients and what is important when it comes to working with trans clients. You have trans women and trans men as well.
Yeah.
So I'm just going to ask as I don't know, because I don't know pretty much. You know, I have experience with myself and I have experience with some of my trans friends who get non-surgical treatments. So I assume that if you have a trans woman as a client, their goal is to feminize their face.
Yeah.
So non-surgical face feminization.
Yes.
Yeah. What happens in their case? What treatments do you do?
I mean, everyone's different, right? I always say there's no rule book when it comes to this kind of stuff. So what will work for you won't work for someone else, right? And I think this is where people think, I'm probably going to jump ahead a second, but just to get it out the way.
Yeah.
You might have an amazing result. Someone will see how amazing it is and they want that same result, but they have a completely different face. So it's a completely different method and technique. Just because you don't have the same technique doesn't mean you're not attractive and you're not beautiful. Everyone, I mean, you can see at the moment, there's like women, they all look the same. The lips, the chin, the jawline, they're all going for the same look. You don't need to strive for the same look just because it looks good on someone else.
That's so
you
true.
have your own look. You are also beautiful.
We all have our own bone structure. You know, not everyone has big eyes, not everyone has small nose, you know.
Exactly. But everything is in proportion and everything, like, you're fine, basically.
Yeah. So you would say work with what you have, not the beauty standard or beauty image or ideal that you have in your head.
Don't come to me and say to me, I want to look like Pavi, right? Because
this is my face and this is your face.
Exactly. Everyone has different bone structure. Like, what works for you won't work on me. Like, do you see what I mean?
So true.
Yeah.
And with trans men, you're obviously doing masculinization. Is it masculinization?
Yeah, masculinization.
Masculinization, which means stronger features, right?
Yeah.
I would assume that You do maybe like a square chin.
The jawline.
The jawline, more square.
So with the difference between masculinization, you aim for more of a boxed look. So with the male version, so you'll basically, if you do cheek filler, you're bringing the cheek filler outwards, right?
Outwards.
Whereas when you're feminizing, you're highlighting. So you're focusing more on the cheekbone and going up. So it's more narrow.
Right.
Yeah.
And also like your face looks more fuller and rounder if it's face feminization, right?
Yeah.
Yeah.
Not
because
necessarily
isn't
rounder.
it like the fat or here? Is it if you do for trans men or masculinization, even for cis men, you wouldn't put a filler here, would you?
No,
no,
you
because
wouldn't do filler there.
It's a feminization, isn't it?
I feel like cheeks is more of like a pretty look.
Pretty look.
Yeah, exactly. And obviously, like, men aren't striving for that.
Right.
So it's more like the jawline and the chin more squared. So it's more, whereas the females, it's more narrow and more like, you know.
Yeah.
Contoured.
Yeah. What about nose filler? Is there a way to feminize and masculinize nose?
To masculinize, I mean, it's probably easier to feminize a nose than do the other way, because noses are noses. They come in all different shapes and sizes. That doesn't identify you whether you're male or female, your nose.
That's a good point.
Yeah.
I didn't think of that.
So for example, when I do facial feminization, I focus more on the T-zone, right? So naturally, a male brow bone is more projected, right? So if you do a bit of filler here, that's naturally just going to soften the nose and it's going to look more harmonious, right? And softer. The chin, naturally, you make it more narrow. That feminizes it slightly. And then the cheekbones, like literally that's your T-section.
Right.
And a bit of Botox, anti-wrinkle injectables just to lift the brows and things like that.
I love it.
But also I do say that just, again, like if you look at models, like female models, they don't all have pointy chins. This is what I mean. It's not just because it's not a rule book, like I said. It's not like a woman should have a pointy chin to make her look feminized. You just go with your bone structure.
That's...
I hope that makes sense and I'm not waffling.
It does make perfect sense. And lots of things I didn't even know. When let's say a trans woman, because most of our listeners are trans women, if a trans woman comes to you, to see you, can she expect results straight away after first appointment?
Yeah. I do it in stages though, so I always warn people, like, you're going to see me quite a few times.
Yeah.
Like, for example, if someone gets a package, I won't throw it all in there and then, because you've got to consider swelling, downtime, and I don't want to be injecting when there's swelling there. That's basically injecting blind, because once that swelling goes, it's like, hang on, I've misplaced, like, it's never happened, but it's more like common sense in the nicest way possible. But you definitely, I mean, you're going to see a difference, but you're not going to see the full result straight away.
Yeah. And I also feel like your face adjusts to, let's say, a filler or Botox. And then I think maybe if they come to see you a few weeks later, you're like, okay, I'm happy, or I want to change this a little bit more.
Exactly.
Rather than do everything at one go, right?
Facial balancing, 100%. Yeah. I always say take your time with this stuff. Like, if people are rushing you and getting everything done, like 5 ml in one session, all right, different areas, but if it's like just all the cheeks, no, red flag.
What is the most popular treatment for facial feminization if people, let's say, if they are on budget?
On a low budget, I would always recommend being realistic. I mean, these treatments aren't going to be £50.
Yeah.
But if I was going to choose one thing, do you know what? Let me change it. If I was going to choose 2 options and you had to choose between the one or the 2, I would probably say it would be the nose and the chin. One or the 2 or both. Right. Yeah.
No cheeks. Do you think cheeks go after nose?
Everyone's got cheekbones.
Right.
Yeah. I mean, cheekbones are cheekbones, but like I said before, it's the T-zone that feminizes everything. That, especially the chin. When I've done people's chin, they never automatically think the chin's going to make a difference, and it makes the biggest difference. So I would say the chin actually is the number one changer on a low budget if you're going to start your journey slowly.
Do you have a favorite treatment that you do?
Do you know what? I really love doing nose filler because that makes a massive difference, like, to anyone. So And it's changed people's lives. Literally, sometimes I've done noses that look better than surgery cases.
Wow.
Yeah, within 15 minutes, no downtime. Like, spend £500 every few years. Like, it's a no-brainer, and there's no risks, like, in terms of like it going wrong during surgery and things like that, or you not liking it, because it's dissolvable anyway.
That's so interesting. Let's say there is a trans woman who hasn't come out yet, who wants to be more feminine, who wants to feel amazing, and they might be scared to, take the first step. Would you have any advice for them?
It's not so much advice. It's more, I mean, I have some clients like that, and what happens is they possibly will actually never come out, but they want to do something, because sometimes they might have their days out where they can be who they want to be, and then they'll go home to their families and things like that. Kind of like two lives, kind of.
Yeah.
But so what I would say, if they're trying to keep it very minimal, is let's give the illusion that you just look very well and you've lost some weight. Right, so maybe a tiny bit of cheek filler and a bit of nose filler and a little bit of Botox, which everyone has anyway. You can't go wrong. No one can say anything. Like, yeah, I had a bit of Botox and I've lost weight. That's all.
That's yeah.
So that you can do something without anyone noticing, in terms of you've just gone and feminize your face.
So there's like a trans woman who hasn't been able to come out to their family, or they can't for any reasons. That's I think that's a really good advice, because as we know, we all have different circumstances, we all have different journey. If trans people decide not to come out in public or to their loved ones, I think it can really help them just for a little bit. As you say, just sometimes when they dress
escape
up or something, it'll escape. Exactly.
Yeah, exactly. And do you know what? You're not harming anyone.
Yeah.
Like, do you? Yeah.
I know people are sometimes really scared if it's their first time and they've seen some horror stories and they've heard horror stories.
Google, basically.
Google.
Yeah, they've gone and probably patrolled Google and seen just the bad things.
Just the bad things, of course. I feel like the percentage of bad things is so little, but everyone thinks it's going to happen to them.
Well, this is it. Yeah, I mean, I get like that with anything. Like, if I go on a plane, I'm going to be like, I'm the one person
it's going to crash.
Yeah, exactly.
Yes.
Yeah.
But there are like thousands of flights every single day. Right?
Yeah, exactly.
Yeah. So there's someone coming to you or coming to anyone for the first time, whether they're trans or cis. I'm aware that there are risks, right?
Yeah.
As with everything. What's the percentage of like risk, or are there any major risks when it comes to non-surgical treatments?
Major risks, I mean, there's always risks, whatever you do. I've never come across those major risks, touch wood. But I think if you're very highly trained and skilled, you know, one, how to really try and avoid it. Again, you're not God. You can be the best person on the planet. 100%. It can still happen to you. Never be too overconfident, because that's ignorance, basically. But I would say it's never happened to me, and one of the main risks would be with filler is a vascular occlusion, which is basically filler blockage of the blood vessels or arteries. Now, if you don't identify or know how to identify it straight away, then you can really ruin someone's face and like cause necrosis, which is death of the skin grafting comes in and things like that. But again, like, it's reversible if you know how to identify it. And this is where the controversy is when it comes to people who don't really know the industry. Have you studied your anatomy and physiology? Have you been doing that for a good few years before you delve into filler? Because you need to know the body. When we don't have x-ray vision. So there is risks. There's downtime. You've got redness, you've got a bit of swelling, depending on the person, but we give good aftercare advice on how to avoid it as well, and pre-care advice as well.
Yeah, I think it's just, there's so many little things that are important to think about when it comes to non-surgical treatments. As you said, before, during, and after.
Yeah, exactly.
Right?
Yeah, the 3 steps.
3 steps, yeah. In Harley Cosmetics London, is there any like a new trend that is like a new exciting thing that just came on the market, or is anything that you are planning to do.
Yes, but we obviously the newest thing that everyone's going wild for is the salmon sperm.
I've heard about
Salmon
it.
DNA is
Salmon
what we
DNA.
say, not to be offensive.
Yeah.
But salmon DNA, some Einstein has discovered that it works really well with our DNA. And if you think about it, salmon and trout, if you look at their skin, you know it's silver metallic. They probably put two and two together because they're so clever and turn it into a treatment, and that's amazing.
So is it injecting in your skin?
We're injecting it into the skin.
Into the skin.
Yeah.
Like everywhere, or just like a certain spots?
People mainly do it around the eyes, but you can do the whole face as well. And I normally say to people, do 3 treatments 4 weeks apart, and then you're getting a good year out of like really good rejuvenation and like brightness, and the glow is amazing. Like, people are loving it.
Is there like any major difference between the salmon DNA,
Yeah,
PRP, or microneedling? Is it like a similar looking results, like the glow?
so microneedling is a device where you basically infuse and microneedle whatever you want to do into the skin, like vitamin C's or whatever.
Yeah.
I would always say that's a really good thing to do, a very mild like depth of needles, often anyway, for rejuvenation.
Yeah.
PRP is very good. I like PRP a lot when it comes to hair growth. I've seen really good results with that. But that's your DNA.
Yeah.
Right?
Because it's mixed, your plasma.
Yep.
It's a mixed plasma with having vitamin C, hyaluronic acid.
You can make a cocktail.
Yeah,
this is the
cocktail.
beauty. Yeah, exactly.
Yeah.
That's also very nice.
Right.
But then these things are pricey as well. So obviously you've got all the famous celebrities doing it, so people are taking advantage of the price range.
Yeah.
But
So the salmon DNA is the hot topic right now.
It is the hot
in the
topic.
industry.
Yeah, that with Morpheus A. I love Morpheus A is my favorite.
I've heard of that. What is that?
Oh, it's the best thing you can do if you want to do anti-aging, reverse the signs of aging, fine lines and wrinkles, pigmentation, loose skin on the body. There's so many different levels and depths that you can do. You can manipulate the settings, burn fat, tighten contour, eye lift, helps with hair growth and stimulation, and it's permanent along with the natural aging process of the skin. These are the things that I really like to push because that saves you so much more money anyway. Like, if you look after your skin, you won't have to do so much filler, or like feminization or not. Like, your skin makes you feel, good skin makes you feel feminine.
Yeah, that's true. That's true.
Yeah.
Whenever I had your treatments, I always felt definitely more feminine after than
Yeah.
before. Always, 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 always.
Yeah.
I forgot to ask you one question when we were talking about the facial feminization. Do you also do feminization on a body?
Yes.
Yes.
We do surgical. We do breast implants.
Right.
Obviously. But we also do non-surgical.
Breast implants?
Breast filler
Breast
and
filler.
buttocks and hip. Obviously.
How does that work?
So we basically inject filler into the areas.
Same filler like you would use for the
No,
face?
so it's designed straight for the body. So it's a different consistency. So instead of it coming in 1 ml vials, it comes in 10 ml vials. So again, that is a process, but that is definitely something, especially the bum area, bit of pecs and boobs and things like that. Can add to
What do you mean by that's definitely something? It's like
that will help like your journey.
really good confidence boost, would you say?
Exactly. That is, I would say, more for people who are already out and they're comfortable. Like, for example, my clients who are totally out, it's like they want to be a blank canvas and do whatever you want to do kind of thing. Whereas people who are not, they're obviously more reluctant to try these things.
Right. How long does, because I know breast augmentation, you have to take them out, I think 10 to 15 years. How long does the filler last?
So the filler can last up to 2 years, but we have clients who go past 2 years where it's never completely gone, and it's created like collagen inductions, like collagen fibers. So if you think, like, for example, when we've done your lips, right, we haven't touched them for years, but they look great
still
because it's creating collagen fibers. So, and I see that with loads of people. But you get a good 2 years out of it, maybe a bit more. Again, it's dissolvable if you don't like it, so you can control that.
Yeah.
And I think it's very important to try and be in control of something. But
is there like any recovery time?
there's downtime. It might be slightly hard for a good 2 weeks. That's completely normal. A bit of redness, some bruising, obviously. I would, because we do surgery as well, I would always ask the clients, why not surgery? Like, you've got the two options, don't get me wrong. I would always say, when it comes to the breast especially, do surgery.
Yeah.
Just get it done.
Yeah.
And it's cheaper. It will end up being cheaper anyway. Yeah.
In the long run.
Exactly.
Yeah.
Yeah.
Have you ever had clients who were like super nervous because it was like their first appointment?
Yeah.
If so, what would you do with them, or what did you do with them?
Okay. I mean, that's very, very common anyway. I've had clients who have inquired from years ago, for example, and we will always do a nice consultation. I think I'm quite friendly and warming anyway, so they feel very safe with me.
She is.
So I will never put pressure on them. If I feel like they're very nervous, I will say, go and think about it and come back when you feel like you're a bit more ready. So it's more just like mentally preparing them. So the consultation is your first step. Once you get past that step, some people have come back after 2 years and been like, okay, I'm ready now, let's do it. Obviously, I've had people who are on the bed, who are extremely nervous, and it's just, I guide them through everything. Like, for example, I'm very vocal. As I'm injecting, I'll be like, just close your eyes. I'm not doing anything until I tell you. As soon as I'm about to inject, I will tell you, and I'll just talk you through it.
Yeah.
That initial moment is always going to be the worst, and everyone is like diffused after.
Yeah.
Because it's like, I can do this any day, like every day. It's the unknown. It's with anyone. Unknown. Yeah.
It's with anything, isn't it?
You just got to be patient. I've got a lot of patience when it comes to my work and people's like mental health and things like that.
Yeah, I think it's important to create a good relationship between the technician and the client and make sure they feel safe, right?
Yeah.
And communication, talk about everything.
Yeah.
And, you know, if someone has unrealistic expectations, talk to them. If someone has no idea what they want, but they know they want something enhance their own natural beauty, again, communication.
Yeah.
Can people do the consultation online as well, like on video, if they, let's say, they live few hours away from London and they don't want to come in person for a consultation for 15 minutes?
Yeah. I've got people who travel from around the country, even the world. Like,
really?
I've got people from Washington.
Wow.
Yeah, and you'd think, but
she's really good. That's why.
It's got it's Zoom consultations. It's the time to be alive. Like, if you can use it, why not? It's we're in central London, our main base, so it's like, it's not convenient to just come in for a half an hour consultation and then go. Some people prefer face to face, but again, like, it's just about making them feel comfortable. I always ask them, where are they at with their journey, just so I can gauge, like, so we can be on the same page.
And one last question.
Yeah.
If anyone who is trans right now is watching and they are a bit hesitant still about, they're nervous, they're hesitant, think, you know, I don't really know where to start. What would you say to them? There's
no right or wrong answer. I think when you're ready, you're ready. I can just be as calm and patient as I can, and when they will come back. And it's not, it's even cis women. It's a nervous situation. I'm just patient. I'd be like, take your time. I'm not going anywhere. And when you're ready, we'll do it. And we'll take it slow. Like, you're in control. That's it, really.
Love it.
Yeah.
Thank you so much, Chrystianna, for being our, I would say, first aesthetic medicine technician on Trans Crash.
Yeah.
Thank you so much for sharing your insight, your knowledge, your experience with us. And I really wish you another amazing 17 years at least.
Oh, thank you. I enjoyed being here. I love doing a podcast. We'll do some more.
Was it your first one? First podcast?
Yeah.
Podcast.
Like, proper like this, like studio setup and things like that. It's really fun.
Thank you so much for your time.
That's right. Thank you for having me.
Thank you so much for watching and streaming and listening wherever you are. I'm so happy that you are supporting us every single week. And remember, on Patreon, Chrystianna is going to perform a little non-surgical treatment for me, little face feminization treatment. And we're going to talk about what I've got done so far and what I can get done in the future. It's going to be exclusive, unfiltered, safe space. So I'm going to see you there. And remember, Roses are red, violets are blue. Every single Thursday on Trans Crush, we are going to educate you. See you next Thursday. Today we're going to do something different, something new, which I have never done before.
Obviously there's going to be needles involved and possibly a bit of blood, so it's not for the faint-hearted. So if it does make you a bit lightheaded or anything like that, look away. Right, Paddy, feel familiar where you are?
Yeah.
Right, raise again for me. I always do a lot of raising and things like that just to make sure that we're getting the right areas.